Oh, wait. Hi, my name is Alina, and I'm going to be teaching you guys a little bit about aneurysms today. So as you can see here, these are just some pictures of what some aneurysms look like. Basically, an aneurysm is a localized dilation or outpouching of the vessel wall or cardiac chamber. So what that means is that there's basically a bulging of the blood vessel. So true aneurysms occur when there is a weakening of the vessel wall, and they involve all three layers of the arterial wall. So the most common types are fusiform circumferential, which look like this. As you can see, there's a bulging on both sides of the vessel. Also, this is fusiform as well. And there's fusiform saccular, which saccular ones tend to be more spherical in shape, and they tend to be on one side of the vessel, as you can see here and here. False aneurysms occur when hematomas that are outside of the blood vessels communicate with the space within the vessels, and a common cause of them is a leak between vascular graft and natural artery. So there's two different types. There's false and dissecting saccular aneurysms, which this one is a picture of a false aneurysm, and here's a dissecting aneurysm. And basically, in both of those, there's a break in the vessel wall, which is usually caused by trauma. So as you can see here, there's a break, and there's a break, as well as in the dissecting over here. The aorta is really susceptible to aneurysms, and this is because there's a constant stress on the vessel wall, and there is no penetrating vasa vasorum in the medial layer. So 3/4 of aneurysms do actually occur in the abdominal aorta, and the most common cause would be atherosclerosis, which would make sense because, as you can see here in atherosclerosis, the plaque formation tends to erode the vessel wall, which then leads to inflammation, and proteinases are released, and those tend to further weaken the vessel. Hypertension is also another cause that can lead to an aneurysm because it increases the wall stress of the vessels. Other causes would be collagen vascular disorders such as Marfan syndrome, syphilis, and infections that affect the arterial walls. Cardiac aneurysms specifically most commonly form after a myocardial infarction, and intraventricular torsion stretches the non-contracting infarcted muscle. So basically what that means is that, it should be tension, not torsion, sorry. But basically what that means is that the muscle that has been affected by the myocardial infarction, it's not contracting, but the tension tends to stretch it, which leads to the expansion of the infarction and then a weak and thin layer of necrotic muscle as well as fibrous tissue, which tends to bulge with each systole. So as you can see, this is kind of a picture of what happens after a myocardial infarction leading to an aneurysm. Signs and symptoms do depend on the location of the aneurysm. So an aortic aneurysm has no symptoms until it ruptures, but after it ruptures, you can experience severe pain and hypotension. A thoracic aorta or aortic aneurysm, you would experience difficulty swallowing as well as difficulty breathing. If the aneurysm impairs the flows to the extremity, as you can see here, you will often experience symptoms of ischemia. And if it's cerebral, often in the circle of Willis, then the signs and symptoms are associated with increased intracranial pressure, and you can experience stroke symptoms when cerebral aneurysms leak. If the aneurysm is in the heart, you can find dysrhythmias, heart failure, and an embolism of the clots to the brain or other vital organs. Aortic aneurysms specifically can be complicated by acute aortic syndromes, such as aortic dissection, which we saw right here. This is a dissection right here. The hemorrhage into the vessel wall or a vessel rupture. And basically, so what happens is a tear in the intima layer right here causes blood to enter the walls of the artery, and then that causes a dissection of the layers of the arterial wall, and they can involve any part of the aorta. So this can disrupt the flow through the arterial branches and can become a surgical emergency. So as far as diagnosis and treatment is concerned, we can do tests such as an ultrasound, a computed tomography, MRI, or an angiography. And medical treatment is typically used if the aortic aneurysms are not proceeding very quickly and usually in the early stages. So typically what we want to do is we want to get people to stop smoking, and we want to lower their blood pressure and how much blood they have, as well as we want to implement the use of beta-adrenergic blockade. So for aneurysms that tend to be dilating rather quickly and are rather large, we usually want to refer to surgery, usually dealing with replacement with prosthetic grafts. This is pretty much what an endovascular surgical technique looks like. So this is an endovascular stent graft being put in, and those tend to allow aneurysm repair to be possible for more people. And that leads to just better conditions for aneurysms for pretty much everyone. So that's about all that I got for you on aneurysms. So I hope you learned a lot, and here's my references. Thank you.